Now, I would like to go to our next speaker, Professor Jessica Dator-Bercilla, from the Faculty of University of the Philippines in the Visayas. She has been very involved and active as investigator as well in the research on coastal cities at risk in the Philippines with the Ateneo de Manila University. She is also a member of the pool of experts, the National Resilience Council, which is a partner of the Ateneo de Manila Innovation Center. So this is much linked, and also we can hear from her involvement. And the lecture will be on localization, COVID-19 challenges, opportunities, and approaches in a coastal city. Please, Professor Jessica Dator-Bercilla.
Thank you very much, sir. I'd like now to share my screen. So are you seeing my screen right now?
Yes, we can.
Okay.
Very nice.
Thank you so much. Our presentation focuses on localization, and this is a bit of a case study coming out from what Dr. Emma has already discussed. And this is really a transdisciplinary effort by the team from the University of the Philippines in the Visayas, from Iloilo City Government, Homeless People's Federation, from Manila Observatory, and our other partners in the city. So let me introduce first the city. The city is actually located at the heart of the Philippines. It's a very small island. It actually sits at an alluvial fan. And if you look at the hazards that historically have hit the city, many of them are climate and weather related. Beginning with drought, storm surges, flooding, typhoons, not to mention earthquakes and fire. Okay. And but at the onset, in the initial months when COVID-19 hit the Philippines, the city was given the moniker of the Wakanda of the Philippines. So if you've seen the movie Avengers and Black Panther, it was given that moniker because it really engaged different stakeholders, innovated on approaches, and there was a lot of hope, but along the way, the city, which is also the center of the region, were met with challenges, particularly with repatriates, overseas Filipino workers, and locally stranded individuals who were coming home, and thus the COVID cases rose along that, and then in a couple of months, there was a major oil spill that hit the coastal waters of the city. And the coastal waters are, of course, where many of the informal settlements are. And so over the, just a couple of weeks back, the city had to declare surgical lockdowns. And it's really mind-boggling that despite the best effort of the city government, and different stakeholders, we still have these problems. And so coming together, different stakeholders thought that there might be blind spots. And we zeroed in on the informal sector and the role of communities in this fight against COVID. And why did we look into this? One, we're looking at exposure drivers, primarily in densely populated areas, where physical distancing measures cannot be strictly followed. And this is also where the livelihood activities are undertaken in narrow spaces. Then you have the social drivers. There would be very high dependencies amongst the urban poor, and the income earners will be driven to resume their much valued livelihoods, coupled with the lack of social protection and the engagement in high risk taking behaviors. There's a big window for that risk to actually increase. And so the team, the research team, which was primarily led in the city, by the University of the Philippines, Visayas, in cooperation with the Coastal Cities at Risk and the National Resilience Council and the Manila Observatory and other stakeholders, undertook a study of social vulnerabilities as part of the climate and disaster risk assessment. But along that line, there was another study undertaken by some of our colleagues at the University of the Philippines that confirmed that local transmission has already begun in the city. And so, added to the already existing climate and disaster risk assessment, we were going to ask a question: what are the socially related factors that will actually drive COVID-19 in the COVID-19 local transmission in the city? And so, allow me to share to you first the analysis of Manila Observatory. You know that in the city they have tried to downscale climate analysis and have found out that over time, while we will still have rainfalls, we will have fewer but stronger typhoons. It's actually drought that will be a major challenge, in the city in the future. And so, together with Manila Observatory, the city government, and our colleagues in the University of the Philippines in the Visayas, and other stakeholders, we reflected upon the interface, between drought and social vulnerabilities, and have found out that, areas that are prominently exposed to drought are also areas with high dependency ratio, without level 3 connection, and mostly non-house owners. And water insecurity will naturally impact on the prices of water, which will make it more inaccessible for the poor. And the danger there is that water is used, for disinfection, and this will limit the opportunities of the urban poor to actually follow the health protocols. Then, of course, there's the problem of storm surges because it's a coastal city. And because the IPCC already projected that marine heat waves, will cause a lot of this weather-related and hydrometeorological phenomenon to hit coastal cities. The houses will be in danger, and you are in an area where the dependency ratio is high. Many do not own their properties, and they have they are without level 3 connection again. In the case of the city, storm surges normally drive people to evacuation centers, and then they would naturally crowd. This will again limit the chances for us distancing. Looking at COVID-19 and social vulnerability, the analysis of our peers also say that there are more COVID cases among 20 to the 30s, not under a shutdown, shared by epidemic, according to health studies, and the current socioeconomic policies are actually driving the most susceptible to more exposure to COVID-19. So and you've seen, of course, the context of our the most socially vulnerable. They are contained in enclosed spaces where social distancing is not possible. They are the most displaced due to hazards. And these are also the population that were displaced and moved and forced to move into evacuation centers by the oil spill. And local transmissions are highly possible where they are not able to comply with those health protocols. And of course, not to mention the mental health issues. While we did state about BRRCC options, those who came together thought, given the best effort of the city, perhaps we should look at the value of localization, activating local and community-based health protocols that involve community-based organizations and volunteers, given the pandemic. And so the city government actually through its the city disaster risk reduction and management council actually tried to develop protocols for emerging infectious diseases. This is implemented soon down to the community level, but also the different stakeholders try to make suggestions on how to possibly localize action. And affirming what Dr. Emma said, there's a need to really include the invisible labor force alongside informal livelihoods and services in the statistics of the city. Community by people's and community-based organizations. And then there's a need, of course, to affirm rainwater harvesting, decontamination, with the help of people's organization in this informal settlements. And that there is a special request that for health purposes, non-COVID-19 related emergencies, especially for the urban poor, be made available in a separate facility. And of course, there's also a need to provide a mechanism for the private sector and other stakeholders to work with community-based organizations. And so with that, we do hope that these recommendations will be accommodated by the city government and other stakeholders so that we follow the pathway of localization as a means to reduce further risks and avoid cascading risks and disasters due to COVID-19. So good morning, and I hope that this sharing has helped widen perspectives and deepen understandings on COVID-19, climate, and health issues. Maraming salamat po.
Thank you very much, Ms. Jessica.